So today we have with us a very interesting personality. He works very closely with our Prime Minister's office and currently leading the initiative which our Prime Minister, Shri Narendra Modi, personally conceptualized. We have with us CEO of MyGov platform, Shri Abhishek Singh ji. So Abhishek ji, welcome to the discussion.
Yeah, thank you, Dr. Abhay.
So Abhishek ji, MyGov has now evolved into one of the most reliable platforms for COVID information. I personally follow this information. So I would like to know a very basic mechanism of how you're collating this information, more importantly, validating it, and what is the source of your information.
Thank you, Dr. Abhay, for the good words about MyGov. And as you might be aware, MyGov was launched as a citizen engagement platform by our Honorable Prime Minister in 2014. And since for the last almost 6 years, MyGov has been trying to be the bridge between government and citizens. What it does is that it involves citizens into participative governance. It gets citizens' inputs and ideas with regard to various policies and programs which the government does, and at the same time disseminates the information about the government schemes and programs to the citizens in a language which is understood by the citizens. We have a huge presence on social media also, because very often we find that many citizens would not type in a government URL to come to our website or use our apps, but they will be on other platforms like Facebook, Instagram, Twitter, LinkedIn. So we push all government information, the relevant information, which is meant for the citizens of India through all these platforms, and build up an engagement with the citizens. So this has been like our prime focus of activity. And given the COVID-19 crisis, we found that one of the key things that was required was ensuring availability of right information, accurate information, and timely information to all the citizens. To that objective, what we immediately did was that we did create a Corona campaign page at corona.mygov.in, wherein we collated all the information which citizens would require. For example, one very key point which people wanted to know was that what is the status, like how many patients were tested, how many positive, and how many have been discharged, how many deaths, and all that. So we started getting this data. The primary single source of data with regard to COVID-19 is the Ministry of Health and Family Affairs website. But given that Ministry of Health's prime role has been in ensuring actions which are medical related, health related, to contain and restrict the virus and to restrict the damage that can be caused, we thought we will support them in awareness and communications part of this challenge. So we, on our campaign page, we started putting all relevant information with regard to not only numbers of people affected, but we also started putting all the government advisories with regard to travel, with regard to restrictions. So in the initial few days when the flights were restricted, there were advisories with regard to movement, there were advisories with regard to lockdown later on, the advisory with regard to the Janta curfew which were launched on 22nd of March. So all these instructions were put together at one place. What students should do, what businesses should do, what government servants should do, what people who are studying outside should do, and what foreigners in India should do. So all this information, whether it was coming from MHA, whether it was coming from Ministry of External Affairs, or from the Bureau of Immigration, and of course from Ministry of Health and Family Welfare, was all put in a collated format at one given place. And once people started coming to our portal for getting this basic information with regard to government advisory and government orders, as well as the status of the spread of the virus, we also started pushing content with regard to what are the do's and don'ts with regard to coronavirus, about hand washing and others. So this content also became a primary source of information dissemination. So this is the way we tried to build it, and the idea was to make it the single source of truth, make people come to this portal to get the right factual information which we can help them protect themselves.
So currently, what is the footprint of MyGov, sir?
Like MyGov registered users, we have registered users of almost 1 crore 8 lakhs that we have. Our apps also have been downloaded by almost, we have app users also which ranges up to 50 to 60 lakhs. And then we have a huge presence on social media. We have a Twitter followers which is more than 18 million now. Yeah, 18, and then we have almost 5 lakh followers on Instagram. We have 5 lakh followers on Facebook. on our Facebook page, and similarly, our YouTube has got more than around 150,000 followers. So we have a huge footprint all across the country, whether through our portal, whether through our tweets, whether through our Instagram posts and Facebook. And every day we calculate our impressions. The impressions reach into millions every day. So we use all channels to ensure the messaging with regard to government regarding COVID-19 and other government decisions is reaches every citizen of the country.
But sir, currently, if you really look, there are a lot of misinformation campaign which is also going on, where a lot of rumors are going on regarding lockdown, regarding number of cases, regarding deaths. So, sir, whether MyGov is taking any active measures to ensure that this misinformation campaign is suppressed or aggressively more a better information campaign from our side so that actually truth reaches the people.
Exactly, that has been one of our prime focus, and we began it with the Mythbusters campaign. So we had like almost 20 infographics in English, Hindi, and now it's in regional languages also. So what we did was that we created Mythbusters because there were a lot of rumors floating on WhatsApp saying that India will be safe because we have a tropical climate, the temperatures will be higher, the virus will die. Somebody said that if you take bath with hot water, the virus will die. Somebody said that if you eat garlics, this will happen, that will happen. So we tried to collate all these myths that were being floating around in social media and started a Mythbuster campaign and tried to get factual information from scientists, from epidemiologists, from doctors. We got AIIMS doctors to speak to us on videos. We circulated that to bust the myths that were circulating around. And then we also started doing a fact check because we very often found that rumors were floating about what curfew will be extended or lockdown will be will mean that nothing will be available. There's a lot of panic, people going to buy their essential commodities in the night, or there were rumors with regard to regulation of by the government on WhatsApp groups. Only admins can post, and this will happen, that will happen. So all these things were like contained by a MyGov fact check. We worked very closely with PIB, where PIB also has a fact check hashtag. So what we do is that whenever such a rumor is floated with regard to any government directions or Supreme Court directions or any medical advice with regard to that, we confirm it from the concerned authority, and then we further share it on our channels regarding, and we call it the MyGov fact check, so that the rumors are suppressed and the right information is shared to everyone.
Abhishek ji, we will continue our discussion. As you rightly said that there is large number of misinformation campaign, and we know that MyGov is taking a lot of steps to actually counter that misinformation campaign. But sometimes it certainly affects the morale of citizens. So whether MyGov is taking some other measures also to ensure that the morale of our citizens is high and we can convert this crisis into an opportunity.
Yeah, definitely. Because see, once what happens is that when such a drastic measure, and like in my lifetime, I should say, is that I have never seen this kind of situation wherein a virus or a disease has caused a lockdown. There have been curfews and there are law and order issues, but they are also relaxed. But this kind of challenge which the nation is facing, I think this is the biggest challenge that we have faced since our independence, and that requires action from everyone. And the most critical part is that, as you rightly mentioned, that how do we make people the morale of the people remain up. So towards this objective, we thought that the best way will be that today, when citizens are armed with lot of information, there is a lot of misinformation also, but there is a lot of genuine information also, and there are a lot of professionals, there are a lot of well-to-meaning people, there are a lot of people working in the corporate sector, in the private sector, engineers, doctors, who also want to chip in, who also want to contribute to the nation's fight against corona. So for this objective, what we did was that we launched an ideas challenge, ideas and suggestions challenge. And on this, we have got so far almost 80,000 suggestions from citizens across the country. And many of the suggestions are like very valid, very important. And we had to, of course, set up a team to start evaluating all these suggestions and then share it with the concerned departments. And many of the suggestions have already been implemented in order to make things better for everyone across the country. And we're really grateful to citizens who have been sharing that. Then we also did something like we were getting a lot of emails and a lot of queries with regard to startups and technology companies who wanted to contribute to India's fight against corona. So we set up a COVID-19 solution challenge wherein industries, individuals, startups could submit technology challenge, solutions. And many of these entries were very good, very considered, and some of the suggestions which were received through this channel were ultimately found place in the Arogya Setu app, which has been designed by the government and currently being used for contact tracing, which is a very important aspect in the whole campaign against corona. Then we also realized that there will be a lot of people who will not be very happy with the Janta curfew or be staying at home. So what we did was that on the call of Honorable Prime Minister when 22nd March was declared Janta curfew to begin with, we started a Janta curfew pledge. And we said that we have a pledge platform in which you read the pledge that I will abide by the instructions, I will not step out, I will do this, I will do this, and I support Janta curfew. So that pledge, in a record time, we got lakhs of people to sign up for that pledge. And the way it is designed is that when you sign it up, you get a customized certificate, a digital certificate with MyGov logo and your name printed there. And then it also allows you to share on social media. So people started sharing on Instagram, on Facebook, on their profiles. So that made people become a part of the whole campaign. That I also am part of this national fight against corona. And then similar things we did for a stay home challenge. We launched a Ghar Baitho challenge on Facebook in the sense that we started asking people to share what they are doing at home. So somebody posted pictures of singing, somebody playing kids games with their children, somebody playing carom board, somebody do making pickles. So people became very creative, and then there were people who sang songs. So all of it, when we started getting on our Instagram page and Facebook page, we started sharing on our handles, crediting them, and so that kind of gainfully engaged citizens in doing creative things while being at home. So the whole campaign was while on one hand we were doing information dissemination, on the other hand we were also involving the citizens in the whole process and making them create content for convincing everyone that why it is important to stay home and why it is important to wash hands. We did the Safe Hands Challenge in which people posted videos of they washing their own hands with the soap, emphasize the 20-second rule. So all that really helps. So MyGov and my team, in fact, and all of them are, I must commend them because all of them are working from home. Someone from Ghaziabad, someone from Faridabad, Noida, all far off places. But they have been collaborating, they have been coming with these ideas, doing these creatives, running these campaigns, and ensuring that citizens far and wide get involved with the government's messaging and get involved with what Ministry of Health is saying, what WHO is saying, in order to ensure that everybody does his own part to limit the spread of this virus.
So, sir, I remember when this MyGov started in 2014, and even now, when it was launched, I think at that time you received few lakhs kind of suggestion, and as a result of which your entire system went down, because there was so much traffic. At that time, our system couldn't handle that kind of a traffic. So do you still feel get into that problem? Do you still face that issue where large number of citizens are very keen on interacting with this platform, but unfortunately we are not able to cater to that demand in a sense?
See, in fact, it did happen recently also because the day we launched our WhatsApp chatbot, we launched a chatbot on WhatsApp because very often we found that people would want to get their answers queried or quickly by sending a message on WhatsApp. So we set up a number that was 9013151515, and on which people could say a hi or a namaste, and then all relevant information with a menu-driven thing would come back to them. So this service began, and we were launching it. It became very popular. Within a couple of days, it reached 20 million users. And then on 26th of March, Honorable Prime Minister was addressing his constituency of people in Varanasi through video conferencing, and he did mention about this WhatsApp chatbot. And that day only we had launched the Hindi version of the chatbot. So the Hindi content was also available. So that day the volumes just surged and the response time became a bit slow. And then we found that the reason was that we were breaching the WhatsApp limit of 250 messages per second. and WhatsApp had never experienced this anywhere in the world with any chatbot that they had. So India is like huge, and we have like people involved. But the best part was that people wanted to get the right information. So immediately what we did was that we added one more line. We added 9013353535, and now we have set up a link which automatically distributes the traffic between these two numbers. So today we are much better off. We are prepared with both lines if the traffic goes up. So now we have a symptom checker also on the chatbot, and people can download the Arogya Setu app through the chatbot. So we expect the volumes to go up, but we are better prepared to handle the traffic. And of course, we also built in a messenger on Facebook Messenger, a chatbot. So there also, whenever people are going, they are getting information with regard to what they need to know about that. Telegram, we have a news channel which has got almost 1 million subscribers. Telegram, I never thought was so big in India, but 1 million people are there on our news decks on Telegram. And there it's like every morning, every afternoon, you will get updates with regard to whatever is the real status about Corona, what government has taken the measures with regard to maintenance of essential supplies, with regard to other information that is relevant for citizens. And we also started something called Positive Harmonies, wherein prominent musicians, they make the appeal to people to stay home, to wear masks, to wash their hands, and then they also play a number or song which kind of creates positivity in the whole environment and makes people not to lose hope and work everything for helping everyone to be able to tide this crisis.
Abhishek ji, currently due to this COVID lockdown, the real brunt is borne by the people who are at lower socio-eco status, poor, migrants, homeless, old age people. They are really finding very difficult to cope up with the current situation. So whether MyGov is taking any initiatives to ensure that their life is improved, or whether they don't face any problems.
See, after the lockdown was announced, there was a lot of panic, especially among the poor section of the people and especially the migrants. And we heard reports about migrants trying to go back to their native places and not finding means of transport, or they're not finding places to stay or places to eat. But at the same time, governments across the country, the city government, state government, they set up a lot of shelter homes and feeding centers to ensure that the urban poor are really taken care of. But the feedback that we got was that very often people didn't know where these centers are and what are the timings and other details. So we spoke to Google and we spoke to the state government's smart cities team and all, and we got the locations of all these shelter homes and the feeding centers, and we plotted them on Google Maps and made it searchable, so that NGOs and all who are trying to help people who are interested in this, they can guide them to the nearest night shelter and the nearest feeding center, and these people will be convinced that they don't need to feel left out. There is the government which is taking care of them, and there are places where they can stay, there are places where they can eat. And we also very often we got to know that many of these people might not have smartphones with which they can get access this information. So we converted all our advisories, all our updates, all our do's and don'ts and mythbusters into podcasts. And we have put them on our MyGov podcast, and then we spoke to FM radio stations, and we spoke to community radio operators and told them that if they can use our podcast on their channel, so the people who are not able to go on a smartphone or go on a portal or an app, they will get this information or through voice on a radio channel or something. So all this was done to ensure the urban poor, the real people who are stressed today, or the migrants are taken care of, and they do not feel left out, and whatever measures the government is taking reaches to them in the right earnest. Yeah.
Very interesting, sir. So, sir, people or the students, youngsters who must be listening to this interaction would be very keen on joining MyGov platform and support the campaign Strengthen the Hands of our Prime Minister and the Government of India. So, sir, how they should join this and what you expect from them in taking our message forward?
See, first and foremost, that we have been asking young people, because especially what we find is that the average age of people who interact with us on social media especially is 20 to 25. the maximum number of people in this age group interact with us. So we do special creatives to which appeals to them, and then the content that we create for different age segments also varies in order to ensure that every segment of the population is takes part in our activities. One area in which the youth and the students especially has shown very active involvement on especially the present campaign on COVID-19 of MyGov is the volunteers portal that we set up. Because NDMA, the National Disaster Management Authority, they wanted us to set up a volunteer portal so wherein people could volunteer and support the government's efforts in containing the spread of COVID-19 across the country. So we have a Self for Society portal wherein individuals and corporates, they volunteer for charitable causes. So on that, we set up an option for people to volunteer, organizations to volunteer. Within no time, we had more than 1 lakh people register there, and this entire information is being shared with the state governments, and the state disaster management authorities are using these volunteers for various kinds of work, whether it's communication related work, whether it's helping elderly people get their daily supplies, essential commodities in the localities in which they live in. So for various kinds of things, young people are volunteering and doing this. We also set up a donors portal on Self for Society, wherein people who wanted to donate medical equipment, they can donate medical equipment, whether it's thermometers, gloves, PPE suits, masks. So we have got like huge donations on our donations portal, and that we are sharing with the state disaster management authorities and district collectors who need it, so that the gap is met, as also people who want to contribute to this national cause can join in and contribute either in person or in commodity through the donors portal.
So, sir, let's close down on this very, very positive note. Abhishek ji, thanks for sparing time and joining us in this very interesting discussions. I hope that our youngsters will find this discussion extremely enriching, and they will join MyGov in their efforts to spread a right kind of information within society and strengthen your hands. Thank you very much, sir.
Thank you. Thank you.